Hi, everyone. Welcome to our final webinar of the Redesigning Maternal Health series. I'm super excited about our speaker lineup this afternoon. I am Stephanie Campbell. I'm a program director here at Health Leads, and we cannot wait to get started, and we'll be starting shortly. Next slide, please. Welcome. I see so many folks from Boston, Pennsylvania. Welcome, welcome. If you're just joining, please drop your name and organization in the chat so that we can see where you're viewing today's webinar from. Before we jump into today's amazing lineup of panelists, there are a few ways to engage. One, I just want to note that if you need closed captions, please click the CC on your screen to enable that. I encourage you during our time today to use the Zoom Q&A to ask questions. Also, we love to have folks engaging with us in the chat. Please feel free to do that. We have people introducing themselves if you just joined. We will be doing a number of polls today, and there will also be a survey at the end of the webinar. This survey is very important as we continue to bring the series to you and future things around maternal health. And lastly, for those of you all who are attending today, please don't take time taking copious notes because you will receive a webinar recording because you registered today, and we'll also make sure it's posted to Health Lead's YouTube page. Next slide, please. Health Leads is a nonprofit organization that was founded in 1996. We work both locally and nationally to remove deep-rooted systemic barriers to health, center power and resources within communities, and build a world where racial health equity is the standard. Our vision is that each person has health, well-being, and dignity in every community. And our mission is we partner with communities and health systems to address systemic causes of inequity and disease. We do this by removing barriers that keep people from identifying, accessing, and choosing resources everyone needs to be healthy. So before we get started, I just wanted to take a quick poll. I know some of you may have joined us in previous webinars. That poll should pop up for you. Please take a moment so we can see who's in the room before we start today. Awesome. It's so great to see that we have some return folks with us. A little around 25% of you all have attended either the first or the second. Shout out to the people who've attended both of our previous webinars. And a majority of you, this is your first webinar in the series, so welcome. You are in for a wonderful treat this afternoon with our panelists. Next slide, please. So who is our lineup? I am so excited that we'll be exploring access to Doula Care this afternoon. We will have Amy Chen join us, who is a senior attorney at National Health Law Program. Brianna Grant will be speaking around she's a health manager, Every Baby Guilford, super excited. And last but not least, we'll have Kyra Betts, who is the creator of Dads to Doula. And today's conversation will be moderated by Brittany Palmer, who's the missions manager in March Times. When I tell you all, curating this series and have the opportunity to prep with these wonderful panelists have been literally food for the soul during this time. I am just super excited for today's conversation. And with that being said, I'm going to turn this over to Brittany, Brittany Palmer will be the moderator for this afternoon. And welcome, Brittany, to introduce herself.
Good afternoon, everyone. We'll go to the next slide, please. My name is Brittany Palmer. I am a birth doula of 5 years at my company, Glow and Grow Childbirth, based here in Atlanta, as well as mission manager at March of Dimes' Mom and Baby Action Network. I'm a semi-outdoorsy camper and lover of food and travel, and I'm very, very excited to lead this discussion today with these incredible professionals. Next slide, please. So obviously we're here to talk about doula access, but what is that and what does it mean? So doula access is the ability of birthing people to obtain continuous, culturally responsive and non-clinical mental, emotional, educational, and physical support from trained doulas during pregnancy, labor, birth, and the postpartum period. Families may or may not be able to choose their provider, but they can choose a doula who reflects their cultural, linguistic, and personal needs. They may not see the same provider month over month, but they can have a doula who stays with them throughout the entirety of their pregnancy, labor, both in birth and postpartum journey. That's a huge comfort during what can be a very stressful time for families. We also know that doula access is a proven strategy to improve maternal health outcomes in the US, and that doula support often leads to a shorter labor, lower risk of interventions such as C-sections and use of pain medication, leads to increased breastfeeding, as well as a reduced risk of postpartum depression. We also know that policies and hospital or clinic protocols that effectively support and actively support doula collaboration into care teams are important. Next slide, please. We can also think about policies like Medicaid reimbursement and advocacy efforts happening in several states to help expand that access as well. We know that with about 4 in 10 births nationally and nearly half of births in rural communities being financed by Medicaid, we can get more birthing people to have the continuous culturally relevant support that they need. Reimbursement also strengthens and sustains the doula workforce, especially community-based birth workers. And if it's not clear, I'm talking about folks getting paid, okay? Birth work is hard work, but it's not free work. And while many of us would like to do it for free, this is imperative, especially in these times where we're all feeling the pinch and need to be able to make a living in order to do this work sustainably. So overall, Medicaid reimbursement creates an opportunity to close gaps in care and advance birth equity. These shifts are critical for Black, Brown, and immigrant families who often face the highest risk in maternal health. Next slide, please. With that, I would like to take a quick point of privilege as moderator to briefly share on March of Dimes' 5-year Equitable Access to Doula Care initiative. Now in its 3rd year, it aims to increase demand for and equitable access to community doula care and improve collaboration between maternity care providers, such as hospitals, via 3 levers of change and a strong commitment to community input and engagement. Those levers and changes you can see here are strengthening demand for and utilization of doula services, as well as system collaboration, such as promoting consumer awareness and collaborative organizational policies with their hospital partners, growing and diversifying the doula workforce, so supporting initial and supplemental doula training, and improving financial and operational efficiency, so supporting organizations in development or enhancement of those third-party payment and reimbursement models. Please feel free to reach out to me with any questions you have about this initiative. I'd be happy to discuss. And speaking of improving financial efficiency, as we think about how Medicaid reimbursement is really opening new doors, it's important to hear directly from those on the front lines of this work. And with that, I would love to turn it over to Amy Chen. Thank you.
Hi, everybody, and thank you to Health Leads for inviting me to present today. My name's Amy Chen, and I'm a senior attorney at the National Health Law Program. I'm going to be sharing with you all today a bit of a broad overview of where states are currently in expanding access to doula care, primarily in the Medicaid context, but also a little bit in the private insurance context as well. And I really hope that this will help provide just a background of the national landscape and where we stand today. I also wanted to mention that much of what I'll be reviewing in the presentation today is available in some form or another, either in our state tracker chart or in our Doula Medicaid resource library on NHELP's Doula Medicaid webpage, which I can drop in the chat. And I think if you can pull up my slides, we can go through the slide. All right, great. Okay, next slide, please. Okay, so for those of you who aren't already familiar with the National Health Law Program, or NHELP for short, we're a national nonprofit law firm that works to protect health rights for all and improve health access, health equity, and quality of services, especially for low-income and underserved individuals and families. We do our work through litigation, policy, advocacy, and education. We have offices in California, where I'm based, North Carolina, where our legal director is, legal director and litigation director, actually, and Washington, D.C., where our executive director and a lot of our leadership team sit. We work really closely with legal aid attorneys and health advocates across the 50 states as well as in Washington, D.C. I've been working on sexual and reproductive health law and policy at NHELP for almost 10 years now. And prior to NHELP, I worked as a legal aid attorney providing direct legal services to low-income clients in and around Oakland, California. Next slide. Thank you. Some of you may already know NHELP's Doula Medicaid project, and/or maybe you've used some of our resources already. I started the Doula Medicaid project in May of 2019, so it's been a few years now. Originally, the goal of the project was to really try to improve health outcomes and address inequities in maternal health by trying to ensure that all pregnant, postpartum, and post-pregnancy people who wanted access to a doula could have one. Our starting point in this work has been in expanding access to sustainable, equitable, and inclusive programs for Medicaid coverage for doula care. You can read more about our work on our website at the link below, and thanks for dropping that in the chat as well. Suffice to say that in our work, we really sort of more broadly speaking, we provide extensive technical assistance, we share information and other support to doulas, state and policy advocates, and other stakeholders across the country. We also try to create and publish resources that are helpful, and we also manage multiple listservs to share state and regional updates. Our focus has always been on expanding to the extent possible access to full spectrum doula care, which includes doula support, not just for prenatal, postpartum, and labor and delivery, but for all the ways in which a pregnancy can end, including abortion, miscarriage, and stillbirth. Lastly, I also want to note that at the National Health Law Program, we're lawyers, researchers, and policy advocates. None of us are doulas. So as such, we've always sought to do our work in partnership with and with the guidance of community doula groups, doula collectives, and individual doulas, especially doulas representing those groups most impacted by disparities in care, including Black doulas and Black-led doula groups, as well as doulas and doula groups that are serving low-income clients. And then I just want to share the image that you see there on the right is an image that we commissioned from illustrator MJ Smith. And the caption just reads, "All pregnant and postpartum people deserve access to full spectrum doula care." Next slide, please. Okay, so here you see a map of the United States, and I have it color coded. So green is the states that have already implemented coverage, yellow is the states that are in progress, and then blue are those states that have taken some other adjacent action, which I can talk a little bit more about in a sec. But as you can see, a lot of the United States is colored here. Right now, we have a total of 46 states and Washington, D.C. that have taken some action towards Medicaid coverage for doula care. Again, either that green direct implementation, the yellow in the process of implementation, or that blue some adjacent action that is aimed at ultimately implementing Medicaid reimbursement. We've seen a lot of action in particular just over the past 3 years. So in 2023, we saw 4 states rolling out Medicaid coverage for doula care: Michigan, California, Oklahoma, and Massachusetts. In 2024, we saw 7 states roll out Medicaid coverage for doula care. That was New York, Kansas, Colorado, Arizona, Missouri, Ohio, and Illinois. And then in 2025, we've seen 4 states roll out coverage: Washington, Pennsylvania, and South Dakota. All 3 of those states was on January 1st of this year. And then New Mexico on in February of this year. Just most recently, just again in 2025, we've seen a number of bills signed into law, including bills in Arkansas, Utah, Montana, Vermont, Louisiana, and Maine. And in most of these bills were new bills that are going to be requiring Medicaid coverage for doula care. In some cases, for example, in Montana, the governor signed into law a bill that is going to basically create a mechanism for state certification and allowing the state Medicaid agency, if they choose to ultimately reimburse for Medicaid coverage for doula care. But again, in either of these instances, for those states that I listed, those are states that are now newly either in that yellow category, they're in the process of implementation, or in the blue category. They've maybe done something adjacent to implementation. In total, we have 23 states that are green, 23 states plus Washington, D.C. that are green here on the map that have already implemented coverage, 10 states that are yellow that are in process, and then another 13 states that have taken, again, some other adjacent actions, such as, for example, in some cases, states have funded, there's a state-funded doula pilot program. In some cases, the states have maybe put in place or created a doula advisory board or a statewide doula coalition. Or in some cases, like I mentioned in Montana, the bill that was signed earlier this year in May, creating a mechanism for doulas to be state certified, and ultimately that is aimed to be a stepping stone towards ultimate statewide implementation of Medicaid coverage for doula care. Let me see, next slide, please. Okay. So probably the most common way that states are implementing coverage is through legislation that specifically requires coverage of doula care as a Medicaid benefit. Typically, this is followed by a state plan amendment. So some examples of states that implemented Medicaid coverage for doula care through straight legislation are Minnesota, New Jersey, Nevada, Oregon, Rhode Island. There's a bunch more. There is still another group of states that have maybe started with the legislation, and even in instances where that legislation has not actually passed and been signed into law, they nonetheless implement Medicaid coverage for doula care through other means. So, for example, in Michigan, there was legislation that was introduced in 2020. That legislation did not pass, but it did actually launch discussions in the state Department of Health and Human Services, and that state Medicaid agency actually took it upon themselves to add doula care as a benefit in 2022. Similarly, in Massachusetts, Mass Health, which is the state Medicaid agency, ultimately did implement coverage following a number of years of different legislative efforts aimed at Medicaid coverage for doula care that were not successful. But ultimately, were successful because the state Medicaid agency decided to implement coverage. Doula care can also sometimes be added as a benefit through the state budget or other funding initiatives. This has happened in a number of cases, including here in California, where I am. And as I mentioned, in some cases, state Medicaid agencies can decide to include doula care as a Medicaid benefit on their own. Next slide, please. So just really quickly, there's really been a dramatic increase in interest in expanding access to doula care in the private insurance context as well. There are 8 states, 4 of these 8 states, this happened last year in 2024, have signed into law legislation that requires doula care in the private insurance context. And I don't have the link handy right now, but I did have an intern that worked with me that just kind of did an update about about expanding access to doula care in the private insurance context. And so that can provide a little bit more information for you all, because I know I think I have another just like 1 or 2 minutes here. Next slide, please. So just a couple of trends that I would love for people to kind of be aware of. First, I'm really seeing a growing number of states being more thoughtful about achieving a sustainable and equitable reimbursement rate. Second of all, as I mentioned in the previous slide, really also a growing increase in efforts to expand access to doula care, both in the Medicaid context, but also the private insurance context as well, which I think is really terrific. And then third, many of the states that have implemented or are implementing Medicaid coverage for doula care, I've also seen the growth and emergence of doula groups, doula co-ops, doula associations, basically mechanisms, state-based mechanisms where doulas are self-organizing to really help alleviate some of the burdens that it entails to become a Medicaid provider. There's obviously a lot of bureaucracy, paperwork, and other challenges that are involved with Medicaid billing and reimbursement. And I think for a lot of the doulas that are working in states that are newly implementing, it's often helpful for them to kind of come together as a group and really build communities for support to self-organize and kind of figure out what best they need to ask for from the state Medicaid agency, and sort of how best to work through that process. Next slide, please. So just really quickly, just this, I guess, final slide. For states that are newly implementing, my number 1 top recommendation is to listen to the doulas, right? Community-based doula groups, including BIPOC doulas and BIPOC-led doula groups, really have to be equal partners in the implementation. I also really encourage states to get it right from the start. We've seen examples of states that have implemented Medicaid coverage for doula care, and then over the next succeeding years have had to keep implementing kind of new pieces of legislation to kind of fix things that weren't perfect to begin with. So really, I encourage states to take the time to get it right to begin with. And then lastly, to not reinvent the wheel. A lot of states, you saw from the previous slide, 23 states now have already implemented coverage. So I really encourage states to try to learn from each other, and not be reinventing the wheel each time. So I think I'm actually out of time. I'm just gonna drop in the chat just our best practices for Medicaid coverage for doula care, which really distill a lot of the information and conversation that I've had with doulas and state advocates over the past several years. So love that, would love that, and hope that that is a helpful resource for you all in your states as you're doing that work. Thank you so much.
Awesome. Thank you so much, Amy, for that wonderful and insightful conversation. Now we will move on to Brianna Grant, who will discuss tools for doula access.
Perfect. Thank you, Brittany, for that intro and that warm welcome. Thank you so much, Health Leads, for this opportunity as well. Next slide. I'm speaking on behalf of Every Baby Guilford. We are based in North Carolina. We are the Guilford County Infant Mortality Reduction Strategy. Next slide. My name is Brianna Grant, and although I carry many of the roles here, the role that I hold most close and dear to me is a community advocate. Today, I get the opportunity to speak about being the perinatal health manager with Every Baby Gifford. I come from a very rural town in Eastern North Carolina. No one ever knows where I'm from, but that's okay. It taught me the importance of family, and I enter RJ work through my passion for supporting teens through their reproductive journey. Next slide. You won't hear her voice today. However, our doula coordinator name is Angelica Mickle. This community-based doula program that I'll be sharing about today does not move without her. She is my side piece, not sidekick, my side piece for real. She's from Greensboro, North Carolina, and her work is centered around supporting families with high-risk pregnancy experiences. Next slide. So, Every Baby Guilford, we are a collective action movement. We see ourselves as the backbone support entity for Guilford County, which means we are working collaborative to build collaborative solutions. That looks like sharing the trust, power, and resources. So we have the shared goal of eliminating health disparities and disrupting those longstanding racial disparities in Guilford County. We understand that we're working towards the shared goal of creating a healthier Guilford County for all. We have many initiatives, and the one that I'm speaking about today is our community-based doula program. Next slide. This program is made up of our wonderful contracted doulas who are providing the emotional, physical, and informational support. We receive referrals from our home visiting professionals, and those folks are providing the long-term case management, peer support, and additional resources for families. Our community-based doula program is managed by Every Baby Gifford. However, it's funded through North Carolina Department of Health and Human Services and Ready for School, Ready for Life. This program launched January of last year. However, doula services is not new to Gifford County. We've had volunteer programs, community-based doula programs for over 20 years in this area. Through that, founded our dynamic Gifford County Doula Design Team, and it is built up of maternal partners that has came together throughout the foundation and design phase of this program. Next slide. There are many barriers to doula access in Gifford County. We know that. Our program is one of the doula resources, not the doula resource for Gifford County families. Here is a list of those barriers, and the one that I'm speaking on today is awareness and information gaps. Next slide. In short, there are many barriers such as cost, limited availability, lack of culturally congruent care, and etc. However, we chose to focus on awareness and information for our first initiative. One of those areas is by creating What is a Doula educational materials and launching our Gifford County Doula Directory June of last year. This is our growing doula access tool to speak to these barriers listed here. One of the barriers is many pregnant people aren't aware of what a doula is because the doula title is not known to all, and that's okay, and not aware of how doulas can support them. Oftentimes, we're familiar that providers are not consistently referring families to doulas, whether they aren't aware or don't have the tools to. And oftentimes we find that hospital staff are either unfamiliar or resistant to the doula role for many reasons. And there's a lack of centralized referral or directory to make access even. So that is what this growing tool is for. Next slide. So in the chat, you will find a link to the Gifford County Doula Directory and the QR code to the right. Now, you're not going to find a fancy website. You're not going to find a fancy landing page because what we needed was an urgent response. And we work for public health, and we know that public health has a process for everything. So we wanted to find something that we could respond and update quickly. And it exists as a live Excel sheet. And that form to the left is where folks can submit their information. So in that digital form, you can submit your name, your service area, where folks can contact you, your specialties, and we check that form once a month and upload it into our directory. We have 3 referral partners as organizations, and then we have 20 plus referral partners as doula service providers. This list is on growing, and this is our tool that we use for referring our families and our referral partners if we cannot serve an individual. For context, in 2023, there were 5,757 live births, estimated about 5,000 plus in 2024. In 2024, we received 172 client referrals for our particular program. We served 62. That's 36% of those referrals. So we were reminded about what we already knew. We can't serve everyone. However, we needed to be able to send those families somewhere else that can provide them with supportive services. Next slide. I will touch on some challenges, some successes, some lessons learned, and some best practices for this specific tool. In this video, you see some of our doulas, some of our service providers. I needed to uplift them because they are the ones doing the work. And some of the challenges faced with this particular tool are here. One is keeping the tool up to date. So as you know, with the schedules of doulas, the availability changed. So one challenge is making sure that we have accurate information. 2 is equity of inclusion, not intended or purposeful, but just the fact of not every single doula service provider serving a triad may be aware of this tool. So it's our goal to work towards that. And standardization. Again, not everyone uses the same word or offers the same tool. So we want to make sure that we're offering a landing area for families to compare options available to them. Sustainability. I shared that we check this form monthly. Well, one, we have to have someone who's checking that form. We also have to be reminded that we have team members who are promoting it and making sure that the community knows this tool exists. And administration. Previously, this form had the title of Black and Brown Doulas in the Triad. Well, due to administrative changes and administrative directives, the language was changed to doulas serving the Triad, not by choice, by directive. Next slide. Some successes to note are visibility and awareness. Families are aware of what doula services are and that it is accessible to them locally, which they may not have known before. Provider engagement. There is a landing tool that our case managers, referral partners, and community navigators have that they can refer families to. We encourage our referral partners to become familiar with the doula service providers. They are who are most familiar with the needs of our clients. So whereas a client may need bereavement support, and doulas A, B, and D may be familiar and have that specialty. So our referral partners are able to refer a client to doulas who specialize in the needs of that particular client. Equity gains. This directory allows us to spotlight our BIPOC doulas, bilingual doulas, and etc. And then lastly, to note, networking. Not only does this create visibility for doulas and clients, doulas are able to network with other doulas as well. Next slide. Touching on some lessons learned through launching this particular tool, we were familiar that directories are most successful when they're linked with the referral process. So families don't just need a list. That's a lot of information to take in. They also could benefit from support in contacting doulas as well. Self-referral and provider referral must both be options, whereas some families want to search privately, some rely on trusted providers before reaching out for services. We understand that transparency builds trust, so we want our doula service providers to offer transparency about their fees, whether they're accepting of insurance, and clear communication about their scope of service. Promotion matters, and so a directory that is not shared widely would not reach the families who are needed most. So this is something that we're ongoingly working towards, making sure that it's posted and shared throughout community. An equity lens is essential. If not managed carefully, we recognize that a directory can only hold better resource doulas. That is not our goal. We want to be inclusive of grassroots and community-based doulas serving the community and offering a wide variety of services. Next slide. Recommendations for any area that wants to launch a centralized directory is to know that it doesn't have to be super fancy and brought out. You don't have to create a separate website strictly for this. It needs to be something that is managed, accessible, and neutral. And so that's what we offered. Not to say that it can't grow to something better, but what we can respond is to a community need. Something that's allow you to filter the choice. And so search by service area and specialty. A tool that is also regularly updated at least every 6 months. A tool that offers multi-language use, which is something that we internally are working on, and offers both a web and printed version. And lastly, community ownership. Our dynamic Gifford County Doula Design Team is designed by maternal partners, referral partners, and doulas themselves. They are the ones who guide the decisions of this particular program. Our collective action is driven by collective input, I'll name it today. And so next slide, we hope this information is beneficial and useful to you wherever you're joining in from. We invite you to join the movement in a number of these ways and where you can stay connected to the collective action with Every Baby Gifford. Next slide. Again, my name is Brianna Grant. The other voice and worker with me is Angelica Mickle. Feel free to reach out for additional questions. Thank you, Health Leads.
Thanks to Brianna for sharing that robust local example of growing doula access. Plenty of best practices to consider there. We'll now transition to our next speaker, Kyra, to discuss increasing access for diverse populations.
Hello, everyone. You can go to the next slide. So today I'm going to be talking about a program that I helped to create called to Doulas, and where we are expanding doula access through the use of Black men, specifically Black fathers. You can go to the next slide. So to tell you a little bit about myself, I'm Kyra Betts Patton. I recently got married. I actually got married after I agreed to do this, and I forgot to have y'all update my name, but it's okay. I am the course designer and lead facilitator for to Doulas. I'm a doula, a trainer, an advocate, a mother. I am a PhD student. I'm currently going to Washington University in St. Louis to get my PhD in public health. And I'm also a certified lover girl. And that is really important for me to always say, because I approach everything that I do in this world, especially when we're talking about maternal child health, I do it through the lens of love, of absolute love. I really want whole families to be happy, healthy, safe, and whole. And until we get there, I just have to keep striving, right? You can go to the next slide. And so I approach this work from 3 whole full-time jobs. I don't know how I manage it. As I already said, for Dear Fathers, I am the designer and lead facilitator for to Doulas. I am the vice president of an organization called the Doula Lab, which focuses on pregnancy resources and doula education in the Southern Illinois region. And I'm also the manager of policy and advocacy at a nonprofit called Generate Health, where we focus on policy changes for Black families. We will envision a future where we see Black families not just survive, but thrive. And you can go to the next slide before you press play. So I could tell y'all all the things about to Doulas and what the catalyst was and how we got here, but I feel like my time was going to be best spent sharing this video with you guys. We recently had a workshop in the Indianapolis area, and this is the recap. And I think that more than my voice, it's great for you to hear the voice of the men involved. You can go ahead and hit play. To Doulas is a program that aims to give fathers, Black fathers specifically, doula-level education. It's a 6-week program or sometimes a 1-weekend workshop aimed at creating seeds of advocacy throughout our communities to let people know what to do and how to get engaged in maternal health solutions.
I really came in with the idea of understanding the issues with maternal health in the Black community. What can I do to learn more to be able to impact my community in a better way, in addition to how can I impact my direct household in a better way?
Indiana in itself has one of the highest maternal mortality rates, and also you find some counties in Indiana that have 2 to 3 times, sometimes 5 times the national average for infant mortality. So it's really important when organizations like Anthem Blue Cross Blue Shield bring us in to teach these fathers in their communities.
After this experience, I have more confidence and knowledge going into medical environments and being supportive. But now I feel more confident that I can actually speak up and ask my own questions.
So I am located in St. Louis, Missouri, but this is a national program. So we have currently reached over 400 men across 36 states and Germany. And the program has several different formats. So there's a 6-week cohort. We're actually in the middle of our 4th cohort right now with guys from all over the US and Canada right now. So that's really exciting. We also have intensive workshops. So there's like specialized programmatic experiences. So one of the things that I'm going to start training on next year is a symposium that is strictly for providers. And it is, I feel like we're giving these men all of this education so that they can be better supports for their families and for their communities. But we have to make sure that the world is ready to receive them, that the providers are ready to receive them. And so we'll be starting that in the beginning of next year. And that's an example of like one of the types of intensive workshops. We also have like single topic 2-hour workshops. So the most recent one that we did was on birth trauma. And we talked about not just the experience of having your own birth trauma, but how that can impact the other people in the room. We talked a lot about vicarious traumas. We had, I think, maybe 40 guys on there. Who are just there to learn more about what's going on in maternal mortality, but then also to learn more resources and build community for themselves. And then we have partner symposiums, and these are like professional development style program education. So this can be for community-based organizations. It can be for managed care organizations. It can be for anyone who wants to learn more about integrating Black men into the maternal care space. We're not just there to teach people about dads to doulas. We're there to teach people about Black dads and the importance and how we can use Black men within our communities to be seeds of advocacy in the maternal mortality crisis. You can go to the next slide. And so this little thing that I put together, it just kind of tells you about like what we've done. And one of the things that I'm the most proud of is that we have a 100% recommendation rate. So all the guys who go through our program, they take a survey at the end of it. And y'all know just from any experience how rare it is to have a 100% recommendation rate, but we do have a 100% recommendation rate. Almost every guy that is in my current cohort was referred by someone who was in our previous cohort, or there's someone who went through one of our 2-hour workshops. And so it's just really reflective of the impact that we are creating. When I was looking to design a doula training class for Black men, what I realized is that there was nothing out there that existed that was culturally appropriate, culturally responsive, and culturally reflective for Black men. And so it was an amazing opportunity for me to be able to create that. And it's really funny because I, myself, and my co-facilitator, Charity Bean, we're the only women allowed in the space. It is a very protected space. We respect the vulnerability of our participants. And when they finish, they go into a Facebook group that I'm not even allowed in. And I think that's just reflective of how important it is for these Black men to be safe and seen and protected within their community. 90% of them felt more confident from going through our course. And I can give you like a little anecdotal, because I have some anecdotal stuff there, but I talk to my guys all the time. And so we actually recently had our first father who actually suffered a loss, a infant loss. His child passed after some birth complications, and he was on our recent workshop to talk to the guys about how being in the class allowed him to feel prepared to be able to advocate for his partner, for his daughter. So even in their loss, he was still able to feel more confident with the information that we had armed them with. It's really important with Dash to Doulas that we are not creating or I would say adding to the current wedge that there is between community and providers. We are really there to help to be a part of the bridge that allows us to have a more positive, a more fruitful experience within the hospital systems. It's oversimplified to say, oh, well, if you Black, just have your baby at home. That's not appropriate for everyone. We have to think about risk appropriate care. And through Dash to Doulas, we are able to reach so many different types of people through so many different types of communities to really get these seeds of advocacy all over the US and Canada and Germany now. That's very exciting for me. I'm sorry, y'all. I'm such a nerd on that. And so, like I said, we're in our first cohort. We've had 2 targeted workshops, and then we have also had partnership opportunities across the U.S. to talk to different communities about what we are offering. And looking at some of this anecdotal data, some of this qualitative experience, um, that they understand the physiological changes of pregnancy and active labor. Think about how impactful that is for a mom or a sister or an auntie, a cousin or something, for the men in her family, in her community to be like, oh, this is what she's going through. This is how the oxytocin is impacting her. This is how the progesterone is impacting her, so that we are not putting women in a position to feel so isolated and like this is some experience that I'm having by myself. We really wanted to feel like a whole family experience. We've had guys as young as 20 go through the program and men as old as like 56 in the program, to just learn more so that they can be a help to the women in their family, but also the men in their community. And knowing how to support my spouse emotionally and mentally, especially in the postpartum. We know that still one of the greatest times for maternal death is in that immediate postpartum, and in that 42 to 100-day mark. We still see that. And so we make sure that the guys have the information that they need to know how to identify signs of a perinatal mood disorders, how to start those conversations, how to make their partners feel seen and heard and respected, and to also connect them to resources. One of the things the guys have to do in our program, they have to do a resource list, just like any other doula training. And so through that, they are able to find up to 50 resources in their communities that are there to help with the perinatal process for men and women, just for the whole family. You can go to the next slide. And so we have our cohort 4, which begins Thursday, tomorrow. I'm so excited. We have a goal in 2026 of 1,000 touch points. And so that will be with men who go through the program, men who go through our intensive workshops, with other doulas, with community-based organizations, with hospital systems. The goal is to have 1,000 individuals touched through the Dash to Doulas program to continue to spread that advocacy and spread that knowledge around the power of involving Black men in maternal health resources. To this point, most resources focus on the mom or the medical community, but we have other people in our communities who are perfectly capable of doing something, and I demand of them to do something. And so we also will just continue to expand our reach through partnerships. We are currently working through partnerships in the state of Indiana, and in the state of Missouri, in the state of Illinois, state of Georgia. And so just continue to expand so that we can get our hands on more folks. And that's it. That's Dash to Doulas. And this is how you can reach me if you want any more information. I see that grin on Brittany's face. Brittany is my girl. Brittany, you're muted.
Thank you, Kyra, for sharing on such an innovative initiative. I know lots of people were touched and are interested, and I'm sure you'll be hearing from them. What a rich discussion and conversation we had today. At this time, we are going to take a moment for some Q&A from the audience and dive deeper into each of your expertise. So I'm excited to do that. We'll start with a simple question. Where can people access doula services? Where can people find doulas? Where should they start to look?
I'll respond quickly since we have limited time. One area is if you are someone who is insured, to start with your care coordinator. Most folks aren't aware that it is provided as a value added benefit or covered through their insurance. So that's the first start. Second start is to ask your OB office as like a community navigator. They're often a point of resource as well. And then ask your people, call your community resource center, Google. If you stay in Greensboro, North Carolina, Google doula Greensboro, North Carolina, and reach out to some folks that may have had a doula before so that you can get feedback on their previous doula experiences. I'll start there.
Anyone else like to add?
I was gonna say more of that. Looking to any local doula collectives that there are, looking for community-based doulas. Also, just asking, using your social networks to ask folks about doulas. I'll tell you, after my first year, all of my clients were referrals. And so ask people, because there are people who may have had babies that had a doula and you didn't even know that they used a doula, and they can tell you about how great their experience was with their doula, or how much they didn't like their doula and they want you to choose somebody else, because not every doula is for everybody. So I would definitely say lean into your social networks.
Absolutely. Thank you both. I want to slide into some questions about Medicaid reimbursement. What are some ways that we can help community-based doulas go about being reimbursed by Medicaid? What does that look like? And I think, Amy, that's probably a question for you.
Yeah, so I mean, I would say if your state, I mean, first of all, I guess I would look and see if there's any activity going on in your state right now. I can drop in the chat the URL for our NHelp state tracker, which basically has all 50 states. You can kind of go to your state and see what activity, if anything, is happening in your state. If the state is labeled in green, that means there's actually already Medicaid reimbursement in that state. So that's just a matter of trying to figure out what the certification process looks like and kind of connecting with the right people. I should say that I'm actually working with a design company right now to try to make that state tracker a little bit more user friendly. I know that it's not great to like have to scroll past like 20 columns. I think I go all the way to like P or something. And then in terms of like if there's nothing going on in your state at yet, then I think, you know, in a lot of states there have been really just doulas or a couple of doulas, individual doulas or doula groups that have come together to really do advocacy, to advocate for Medicaid coverage for doula care in that state. I actually think, honestly, that's the best way if the doulas in the state are self-organizing, because what happens then is that doulas are often able to either by themselves or working with other advocates, basically like write the legislation that they want to see, kind of design the program that they want, and then they can pitch it to a legislator. You know, what I've seen it in some states where maybe the legislator, like a well-meaning legislator, has maybe kind of written something on their own, but sometimes they don't always know who to reach out to, and sometimes stuff gets written that is not that has not been written in partnership with doulas, and sort of doesn't end up really taking into account a lot of their needs. I can lift up again just sort of that best practices document that I have, just because I think it can be helpful if it can be helpful to look at what other states have done. And so for each of the best practices, you can see in the drop down menu, I have states that have put in place that best practice and then a link to sort of what they've done.
I also wanted to add, in the state of Missouri, we could not get the legislation passed. It has gone up and not made it out of committee a lot for many years now, since like 2018, 2019, maybe even before that in some capacities. And so what we were able to do was to get Medicaid to take the administrative route to provide the doula reimbursement. And for those who don't necessarily know what that means, that just means Medicaid decided we're going to do it. And this is how we're going to do it. And the doulas, a lot of us were able to help inform on the rules around the Medicaid reimbursement. We would love to get the legislation passed, something submitted in, you know, in time, but we still had the administrative route because we were able to build that partnership with Medicaid and express the importance of the rules to be a certain way. So that would also be just another recommendation is if the legislation won't get passed, build connections within Medicaid, with the directors, with it could be somebody who answers the phone, someone who you can get to understand and empathize with what you are wanting to do with doula reimbursement.
Excellent. Thank you both. Uh, Thinking about consumer awareness, thinking about that question of like where to find doulas, where do you find clients? How do you all work to raise awareness of doula services, not just to Medicaid beneficiaries, but to all that could benefit from the services?
That's a great question. I'll start. One way is if you are a birth doula, where do you find pregnant folk? Go there. So build relationships to Kyra's point, build relationships with the social workers or the community navigators in OB offices, in childcare facilities, in schools. Go to these community meetings, like neighborhood associations, all of those places where folks frequent. Your face should be a part. If you're looking to where do you put marketing, visit a local library that have the childcare places. Put your business card up there. Social media is great, but everyone's not going to find you on social media. You have to have a landmark presence. And then, of course, reaching out to other agencies and groups that work with families. So places that offer childbirth education, places that offer parenting classes or things of that sort, like support groups. Build relationships with those entities so that you can become a source of resource or a walk-in resource for their information.
Any other thoughts? I know I said not, I didn't mean to exclude Medicaid recipients or beneficiaries. Are there any best practices as far as raising awareness with to Medicaid beneficiaries that anyone would like to speak towards?
One thing that I can say is that in a lot of the states that have implemented Medicaid coverage for doula care, I think this outreach and education piece has been not forgotten, but maybe not as stressed. And so I think it would be great for, especially for states that have not yet implemented or even states that have implemented, to kind of think about, whether that means trying to have the state allocate funding towards education and outreach, or maybe even reaching out to like other external funders to try to think about greater outreach. Because the reality is that Medicaid enrollees are always getting a bunch of paperwork. When you are pregnant, and I speak from my experience having been a legal aid attorney and working with clients who are on Medicaid who would get like a stack of stuff when they're pregnant that they're kind of supposed to look through, and maybe somewhere in there's something that says, hey, you're eligible for doula. But again, like I think there really have to be all the touch points that are touching that pregnant or that pregnant or birthing person. I think whether that be their the person that they're going to for OB care or midwifery care, a friend that they're talking to at church should be talking to them about doula care, right? Like their friends but basically like it would be great if there were just like more touch points in the community that are informing about the availability of doula care, but that means more outreach and education to all of those folks too.
Brittany, can I also lift up something in the chat? Someone mentioned the Doula Ambassador Program from Birth Without Bias. I heavily push for this as well. They have a Doula Ambassador program. It's not provided in every state, but if your state is included, definitely a great resource to build your network and become more familiar. And then to also add, whether you are a birth, full spectrum, postpartum doula, if you know of a doula who has been in the work for a while, they're more seasoned, they're more familiar, ask them. Find your mentor, someone that you know is doing the work that you want to do. You have to ask the questions and you have to become comfortable. Don't be afraid to do that, because chances are they've learned from errors and mistakes and they can coach you on what mistakes not to make.
I love that. I have so many mentees I love it. Please ask me for help. I think it's so important to lean in to the doulas who have had to fail.
Yeah, thank you. Some really good insight. Could you all talk a little bit? I have an audience question that I'll bring up. And Brianna, I think this might be suited for you. I live in a border town, and to my knowledge, we currently only have one practicing doula in the area. What are some effective strategies or programs I could explore to help recruit and encourage more individuals to become trained doulas in our community?
Sounds like this question is coming from a doula. Maybe. I live in a border town and there's only one other practicing doula. Did I get that right? One area is to look in the areas that does have doulas outside of your town, like the closest area. Are they 30 miles away? What's that distance? And then inquire about their service area. What I've seen in other areas that are rural communities is they partner together to ask the question of who else do you know either want to be trained or has an interest in learning information so that you can bridge a gap there. This isn't a full answer, it's more of a thought out, someone, add to it. But what I've seen that work is partner together. You can't do it alone, for one. And then to reach out to those virtual offerings as well to build up your resource offering. It may not be the role of a doula. Maybe it's educational classes, virtual support offerings, because you can't support for everyone. Like you can't burn yourself out trying to offer services, especially if they're limited. I can offer that, and I'm going to ping it over to my colleagues.
I would say look into scholarships that are out there available for doulas to get trained, and see if there are virtual training options available for them. If there's enough people who decide they want to become doulas, can you get a training to come into your area to train some more doulas? Definitely looking at the doulas who are like out in the surrounding areas, but I definitely try to get more doulas trained. When I first started, I can think of 10 doulas who were like out active working public doulas in the greater St. Louis area when I first got started. And now it's innumerable. I cannot count how many. And so many people have been able to become doulas through scholarships and through just getting together like, oh, we want to do this doula training, let's get someone in to do it. So and there's also lots of virtual doula trainings available as well that are really good.
Thank y'all. Thank you. I want to switch gears a little bit to talk about systems collaboration, and specifically what it looks like for doulas and providers, our hospital systems to collaborate and work together. So question from the audience, how can we better foster or how can we foster better collaboration between OBGYNs and other providers and doulas? What does it look like to build mutual respect and ensure that doulas are seen as valued members of the care team? And that is a question to anyone, because I think you all probably have best practices there.
I'm currently a part of a work group that is working to develop a doula, like an actual for real doula policy for a hospital and demanding those. It's not gonna always just happen because we ask nicely. Sometimes we have to like put our foot down and say we are a valid part of the care team, and you can't stop us from being a valid piece of the care team. That we often have a better rapport with the birthing person than anybody else in the room. They have spent more time with us and seen us longer than their providers. And so to get people to continue to understand the importance of continuous care and the importance of doulas and our specific skill set. I think often people think because doulas are not medical professionals that we are not as important in the room as the medical professionals, but we are the client professionals. So basically put your foot down and don't lift it up.
Anyone else like to share around what it looks like for doulas to feel or be included in the care team during labor and delivery?
Yes, I can add a brief. Kyra, I love your response. Foot always down on the neck. But also, also identifying a champion who actually is a part of the medical team. Champions, excuse me. So that champion could be an OB. It could be someone that sits on the leadership board. It could be a part of the foundation, someone who's dispersing dollars. But you need someone that you can trust to share your questions and concerns with, and they can take those back. And then you can trust that they would bring trusted information back to your cohort, to your group. That works when there is an existing partnership. Now, for hospitals that may not as welcoming of the role of a doula, you got to be creative where your champion may be someone that can only do this piece. So you have champions in different departments. That's what's worked in our area, specifically one of our hospitals. maybe a little bit further than the other. Doesn't mean that work is not still happening. They're just on different levels. But it can't just be the doula speaking for the doulas. Doulas need champions as well. The same way as we're advocates, community advocates, doulas need advocates for this piece too.
Excellent. Excellent. Thank you. Amy, were you looking to share? I'm so sorry, I can't see you anymore. All right, well, let's move on to our final question. Really want to put out a call to action for these fine folks in the audience. Each of you are working on access in different ways. What's one thing that the audience can do to continue to advocate for doula access?
Learn what is going on in your specific state with doulas, with reproductive justice, and get involved. We are past a time where we can be passive. There are no innocent bystanders in maternal mortality. And so making sure that you know what's going on in your area, you know what the doulas in your area need, as far as allyship, as far as support, and doing that. If it's writing letters, if it's helping to put together a workshop where people can refine their skills, whether it's if you are someone who's really good with business, help the doulas because most doulas are running their own businesses. If you are an accountant who provides tax services, provide them to doulas for low cost. Things that you can do, anything that you can do to help the sustainability of the doula career, do it. And do it just because it's the right thing to do.
Thank you, Kyra. Brianna or Amy?
Yes. Yes, yes, yes. And then two things. Invite us into your social circles. We can't be everywhere, but they're not just one voice, to Kyra's point, whereas there was maybe 10 doulas before, there are hundreds now. Same in our area as well. If you have community organizations that you're a part of, your religious or faith background, your church community, invite us to speak, whether it's 5 to 15 minutes. Storytelling is very important in this work of reproductive work. And so the more that we communicate about our experiences, about the resources that are present and how to utilize them, the more aware our community are. Sharing information is how we get further. Sharing information is how we decrease our infant and maternal mortality rates. And the more we have educational and learning experiences, we can do that. So just invite us to share. It doesn't have to be some super duper huge event. It can be after this event, we're going to have Doula Kyra, and she's going to share about what's happening in her program, or they're going to share about what a doula is and if they could be beneficial for you. Boom, you have opened the door, you have pulled up a chair, and continue to do that because, again, it's the right thing to do.
Awesome. I'm loving all of these little tidbits that are kind of guerrilla style, kind of, do it as you can. And I also love the point around everyone is not going to be a doula, right? So if you jump in at your level of expertise, and that is helpful in and of itself. Pass to Amy for final thoughts on actions that the audience can take for advocacy.
Yeah, I would say that I think I alluded to this in one of the Q&As that I answered that I typed in, but I think I think that the next few years are going to be really challenging for state Medicaid agencies, because of some of these changes and cuts that are coming down that, I'm just going to be honest, are really going to be devastating, not just for Medicaid enrollees, but are really going to change the landscape of healthcare more generally. I think everybody's quality of healthcare is going to go down, and I think everybody's prices are going to go up. So, with that being said, I do think that that now is actually a good time to continue advocating for expanding access to doula care, especially because, the reality is we are going to see some maternity wings closing. We are likely going to see rural hospitals close. And so I think that additional type of support, especially the sort of like more holistic, like community-based doula care support that we've seen, where a lot of the Medicaid coverage for doula care programs, they're sort of intentionally allocating the postpartum benefits for like the full 1 year after the birth. And so I think like that kind of idea of doulas that are able to really follow the family, I think that's going to just be more needed more than ever, especially in the Medicaid context for a lot of these families. So I would say, even though I think it is going to be a challenging time in terms of being able to advocate for some things in Medicaid, I think there is still a really good argument to kind of continue and not let the momentum slow up in terms of expanding access to Medicaid coverage for doula care, especially now.
And thank you so much. With that, I will pass back to Steph.
Oh my gosh, you pass it back to me and I'm so caught up in the conversation. I can't thank each of you enough for your brilliance today, and just what you've contributed to today's discussion and the efforts you're doing both locally and nationally. I'm in just such deep gratitude and awe of you all. You know, I've been fangirling over all of each of you and loving up on you. So thank you so much. I want to encourage today's guests. As I said, you'll get a poll that's going to pop up. Thank you for tuning in. If you enjoyed today's conversation, please share it with someone that was not here today that may have missed it. If you missed the other two webinars, please go to our YouTube channel, check those out. And again, if you are not subscribed to Health Leads newsletter, please do that to stay into the loop. And if you want to partner with us or talk more about maternal health, please reach out to Taji Hill. Her email will be dropped in the chat. Thank you all for your time and attention today. Have a great rest of your week.